I'm Katy Milkman, and I am so excited to be presenting to you today about some of my research on the question of whether or not text messages can save lives. I'll tell you about some work we did nudging vaccination. I should say before I go any further that this is joint work with an absolutely incredible team, including notables such as Angela Duckworth and Mitesh Patel, who were key point people with me on this project, as well as the Behavior Change for Good initiative staff. I want to take you back in time to explain this research project to late spring of 2020, which was right as we were all thinking maybe about coming out of COVID-19 lockdown to some degree, and really hoping that vaccines might be developed that could get us out of this pandemic, or at least ease the burden. And we saw an issue coming down the line as we were looking at data and as we were looking at the past, frankly, which is that lots of Americans were not that interested in vaccines. Even if they were readily available, many people said that they would not rush out to get vaccines against COVID-19. And this is not just the case in the United States, which is where we were interested in doing research, but this is the case globally, that there were lots of people who were anxious about the idea of taking a vaccine that had been developed so rapidly. Not only that, even if people weren't anxious about the vaccine, they might not line up quickly because lots of people don't follow through on their best intentions when it comes to things related to their health. So as a result of this, Mitesh Patel, Angela Duckworth, and I all saw an opportunity, and we wrote an op-ed in USA Today, which basically argued that not only should we be paying lots of attention, devoting lots of time and energy to developing vaccines that might help us ease the burden of this awful pandemic. Not only should we be thinking about scaling up the distribution of those vaccines quickly once they became available, but we should be thinking about the behavioral approach we would take to encourage vaccination. And again, remember, this is summer of 2020. No one was really having this conversation yet. It would become a hot topic in the summer of 2021, but it was not yet on most people's radar. But we thought, let's get out ahead of it. We knew already that just half of Americans get a flu vaccine, even though it's recommended for virtually all. And we thought this is sort of a similar problem that's likely to come up down the line when we have COVID-19 vaccines. Maybe we could actually use flu season in the fall of 2020 as a bit of a pilot test to try to figure out how can we encourage vaccination effectively in this one setting that's so similar to the pandemic setting coming down the line. And then we would have ideas and insights ready to go, ready for use as soon as vaccines for COVID became available. We felt this was actually a problem right for something we call a mega study. So essentially, when we define a mega study, we think of it as a massive, massive field experiment in which all of these ideas are tested simultaneously. And it can be really valuable in a setting like this one, where we want to rapidly develop insights and best practices that are going to have relevance to policy. So a few of the benefits of this approach include allowing for comparability of results across studies. So you don't have to worry, oh, well, this worked to change behavior by 3 percentage points in a population of Danes, and this worked to change behavior by 7 percentage points in a population of elderly female Californians. But will those effect sizes translate when we roll them out in the same setting? So the comparability is really valuable of the mega study. It can also be run as a tournament and draw from ideas across disciplines. So you don't have to worry about scientists having sort of their own siloed ideas and wanting to work in different disciplines, but you can actually pool them all together and just compare what's the psychologist's best insight, what's the team of economists' best insight. Let's put them all in one massive study and see. It can accelerate the pace of scientific discovery, which was extremely important in this context, by instead of running studies sequentially, running them all at once. And I should say that you can pool many mini studies, right, with a control and treatment condition into one massive mega study and just have them all be different treatment arms. Okay, so we said, let's do this. And we went out and found some wonderful partners that allowed us to test different ideas for encouraging flu vaccination, with the idea that each idea tested would be designed so it could easily be ported and transported to encourage COVID-19 vaccination. So our first pilot was with Penn Medicine and Geisinger, two large US health systems with millions of patients. And specifically, the people who became part of this project were patients who had a routine primary care appointment during the 2020-2021 flu season at either Penn Medicine or Geisinger Health. And we had about 50,000 people who came through in the fall of 2020 and who were candidates for a flu shot at one of these healthy visits, who were randomly assigned to different treatments in our mega study. Specifically, those patients were randomly assigned to one of 20 different experimental conditions. There were 19 different treatments tested to encourage vaccination, and one control group that got sort of business as usual care, where they're still getting reminders to come in for their doctor's appointment, but they aren't focused on flu vaccination, and they're still being invited and encouraged to get a flu vaccine at that appointment. So there are about 2,300 people per experimental condition. And what we'll measure in this study is whether or not people actually accept a flu shot when it's offered to them at the appointment, or if they get one somewhere else in the 3 days leading up to that after we've started messaging people, in case the messaging leads them to rush out to a local pharmacy and get their vaccine rather than waiting until they see their doctor. Their experimental condition, patients' experimental condition, simply determine what text messages they would receive from their care provider in the 3 days leading up to their doctor's appointment, and what those messages would say, trying to encourage people to accept that flu shot when they show up and the doctor offers it to them. And we actually had a team of 26 different scientists who submitted the designs of these 19 treatments, and they had all different hypotheses about what might be successful to encourage vaccination. And just to give you a sense of the range, because I'm not going to get to talk about every idea tested here in detail, one team said, hey, could humor be used to boost vaccination rates? What if we told you a joke? So have you heard the one about the flu? Don't spread it around. That was one joke that was tested. Would it be particularly appealing? This is another team that had this idea to dedicate your vaccine to a loved one. We often dedicate running a marathon to someone we care about, for instance, but what about dedicating a vaccine? Or what if we told you a vaccine is reserved for you and tried to play on the endowment effect? Would that make you more likely to get a shot? Would you value it more if you felt it had your name on it? So we randomly assigned people to the conditions, and then we tested. And what we found in this particular study is, first of all, the text messages on average did improve the likelihood that people would accept a vaccine when it was offered to them at their appointment. If we just pool on average, the text messages led to a boost. But I also want to highlight that we saw a top performer that was exciting, that sort of leapt out of the pack and increased vaccination rates in this sample by about 10%. Though you might expect an attenuation of that in a replication, since this is the top performer is necessarily an outlier. What that message communicated is just that a vaccine has been reserved for you. And actually, 3 of the top messages use this reserved for you language, and none of the rest did. So incredibly potent, it seemed, if we do just an analysis of this data. And when we did other things, they were not nearly as effective. Sharing a joke was one of my favorite ideas. It didn't perform very well. And generally, my predictions, the predictions of other scientists, weren't nearly as useful as testing, which is another important takeaway from this, that testing was more useful than expert prediction by far. Just to show you what this messaging strategy looked like, it was really very similar to what you might expect to normally get from a clinician. 72 hours before your appointment, you're told that a vaccine's available and you should get it, and here's the time of your appointment. And then 24 hours beforehand, you're reminded that this vaccine has been reserved for your appointment with the doctor, and to please ask to make sure you receive it. And of course, it will be offered to you whether you ask or not, but it's giving you that additional prompt. Okay, so key findings from this study, these 2 reminder messages encouraging people to ask for the flu shot, letting them know it was reserved for them, boosted vaccination rates substantially at nearly 0 cost and significantly. And when we did sort of meta-analysis, tried to look, across all these things, what are some of the shared attributes of the best performing messages? It seemed that generally the messages that framed this as a reminder to get a flu shot that was already reserved for you outperformed others. And it was also important not to use messaging that felt too casual or unusual to get from a provider. So those kinds of messages with interactive messaging or casual language or jokes actually perform very poorly. Okay, we ran one more mega study that was actually even bigger than this one, and that was with Walmart pharmacies, which have 4,700 locations across the US. And with Walmart pharmacies, we were nudging people to come and get a flu shot. So it's a little different than accepting one when it's offered to you by your doctor. Here, you actually probably have to get into a car, drive to your local pharmacy and ask for a shot. And we did this with patients who had received a flu shot at Walmart in 2019. So it is a select subsample, and that's important to point out. It's probably not ideal, but from a legality perspective, it was acceptable to message these people. And we thought we could learn a lot despite the limitations of the sample. So we ended up with almost 700,000 participants in this study who had received a flu shot at Walmart in the prior year and were being nudged to come and get one in the fall 2020 flu season. Patients in this experiment were randomly assigned to one of 23 experimental conditions, and we had about 30,000 people per condition here. We had 22 treatments and one usual care control where people weren't reminded to come and get a flu shot via text message. And again, it's a text messaging study. The outcome was whether or not someone received a flu shot end of the year of 2020, and people's experimental condition that they were randomly assigned to determined what text messages they received from Walmart on September 25th, which was launch date. And for up to 3 days after that, people could get one additional text message. And we had 24 scientists who designed 22 different treatments, and they were testing all different hypotheses, some quite different in the context of the pharmacy than they had around what might work to encourage people to accept a vaccine from their healthcare provider. But there were some overlapping ideas as well. So some of the ideas that got tested in this setting included, can describing a vaccine as a way to protect your family and friends boost uptake? Does learning that more and more Americans are getting flu shots each year make them more appealing? And would considering all the places that you could catch the flu make you more likely to receive your shot? So we randomly assigned people these different experimental conditions. The first thing I want to say is with enormous statistical power come very positive results. Every single text message reminder we sent significantly improved vaccination rates over and above the control. And on average, we can just say confidently that text message reminders therefore work. But we also see more variability. We can detect bigger differences between conditions and say that there is significant heterogeneity in the performance of these messages. And the best performer, interestingly here, was telling people a flu shot is waiting for you at Walmart, a very simple message that echoes the best performer in our prior study, which was a flu shot is reserved for you. Here, we couldn't use that reserved for you language because there was some anxiety about stockouts. So we subbed in the waiting for you language, but it's really quite similar. And several of the top performing messages used that language and none of the low performers did. It also was effective, though, to say things like more Americans are getting flu shots than were in the past. Just to show you how simple the top performer was, it again just said, hey, it's flu season, come get this flu shot at Walmart. They prevent the spread. And then 3 days later, remember that it's waiting for you at Walmart. Okay, key takeaways when we analyze the data here. Again, this waiting for you language was important. And there are 2 messages that were a part of this top performing study. And I should say that came out as another thing that really mattered in the study was multiple messages were better than a single reminder. So nagging seems to work. And that waiting for you language seems to work. Importantly, you might be wondering, does this actually extend to COVID-19 vaccine take-up? That'd be a great question. Does this sort of ownership language that seemed to work so well, designed by some of our team scientists, matter when COVID vaccines, you could argue it's really different. It's a global pandemic. But the wonderful news is that Heng-Chen Dai, Sylvia Sicardo, and a team of collaborators, both of them were actually part of the team that did these mega studies. They sort of ran with this insight and went and rolled out a test of this kind of ownership language, come claim the vaccine that's waiting for you at UCLA Health Systems right when vaccines became available, and found that text messages reminding people to get a vaccine, again, significantly outperform not sending text messages. And when you use this ownership language, it improves take-up. So we can say that these mega studies developed insights that were used successfully to encourage COVID-19 vaccination, which is exactly their goal and was really exciting to see. And if you're wondering about why it might be that this was so successful, there are probably a lot of different reasons that ownership language matters. Maybe partly the endowment effect. It may be that it suggests to you that it's recommended. Why else would you have your provider reserving a vaccine for you? It may also seem exclusive. John Bogart of UCLA has done some wonderful follow-up work based on these exciting results, showing in settings outside of vaccination, from downloading a book to joining or attending a conference, when you're told it's reserved for you, it seems to make you feel that it's an exclusive, enticing opportunity. So really excited that so many wonderful researchers followed up on these results from the mega study to dig into why it works and also show that it could help with COVID-19 vaccine take-up. Last thing I want to do before I wrap up this presentation, which it has been such a pleasure to give you today, is to share a few broader evidence-based tips for encouraging vaccination, which is going to be an ongoing issue around the world as we need more boosters every year, as we need to continue to get flu vaccines, and as other pandemic threats may arise. There is a lot of evidence now about what works and what doesn't. And the first thing I wanted to point to that I think we should have done more of in this case, by the way, is giving people vaccine appointments by default that they can easily reschedule. Just saying, we've put you on the calendar. Here's the date and time where we've scheduled you for a vaccine. You can, of course, reschedule or cancel, but come on in. There's wonderful research by Gretchen Chapman and collaborators showing that this significantly increases vaccination rates. I did work over a decade ago with a wonderful team of economists showing that maybe not as effective as giving people a date and time, but still effective and better than nothing, is to prompt people to write down the date and time when they plan to come and get a vaccine. So if you can't just give someone a default appointment, you can at least prompt them to write down what's the date and time and maybe communicate that to someone. And that planning action seems to be valuable in and of itself. We now know that text reminders to get vaccinated are very consistently useful, although I should say that the benefits of these approaches have also been proven to wane as we get to the more hesitant in a population. So I think these kinds of tools are going to be more useful as we're thinking about boosters among those who have already gotten a vaccine, and less useful among the small population of people who are real holdouts and vaccine hesitant. Similarly, among those who are trying to communicate to get boosted, where we're trying to close an action intention gap rather than have a persuasion challenge, communicating that a vaccine is reserved for you or a booster is reserved for you seems to be a very good idea. There's also some research suggesting it is powerful and useful to say that a vaccine is the norm. Everybody's doing it, you should do it too, is a much better message than, oh no, a lot of people still aren't doing it, we hope you'll come along and get one. Because when we think everyone else is doing something, it seems like a more desirable behavior and less risky potentially. I also want to point out that although there was some initial promising research, I'm discouraged by the evidence on the use of incentives, having run a randomized controlled trial related to this myself in the city of Philadelphia with a vaccine lottery that we were able to randomize elements of, and also working with a team that analyzed data from across the United States on different incentive programs. We really didn't see benefits from incentives. So I don't think that's the right use of resources unless they're much larger than what was being rolled out, sort of in the $100 and less range. But mandates really do work. And so I think even though they can be unattractive in many settings, and if we can avoid them, we might want to, they also do have proven efficacy. And so when we are in a situation that's life or death and we need to use them, they should be used in certain cases. They work. Okay, let me leave you there and just say thank you to the amazing funders and collaborators who made this work possible. And it's been a real pleasure presenting it to you today.
Just one favor, if you want to keep Nudgestock free, click the like button because the algorithm likes it, and click the subscribe button too. The algorithm likes that, and unlike the like button, it's actually useful because you'll get notified of future content from Nudgestock whenever it becomes available.